pleasure to have three friends here today who are soulmates of mine. I hope that doesn't scare you. About, first off, children, and then trying to improve the quality of their physical and mental health. Isn't that how we are soulmates? One of the ways?
We certainly are.
Thank you, Dr. Ryder. When I moved to San Angelo, it was very soon after I arrived, almost 4 years ago, that I learned that San Angelo ISD had a great partnership with Angelo State University School of Nursing for a school-based health center at one of our elementaries. And it had been a decade or so of my career of having two school-based health centers in another district that I felt like had improved the quality of life for children to such an extent that I knew this district had a gift by having this already established here. But what has happened, marvelous improvement, is some more grant money, and we have been able to do two major things. One is add staff physicians. It's covered by a staff physician all the time during the 5 days a week. Mm-hmm. And then this year to add mental health services, and wow, what a gift to this district. And so now I'll introduce the folks that are helping to bring about this amazing gift that really very few schools in our nation have anymore. Back when I helped start the two school-based health centers 14, 15, 16 years ago, there was some money out there from the federal government, and there were 250 or so nationwide. And I bet it's down to a very small number now of school-based health centers. But this is Dr. Scott Storm, who is a psychologist and who just came full-time a few months ago.
Yeah, July 12th.
Wow. And was already in our city at La Esperanza, and now is at our San Jacinto School Health Center. And Dr. Jane Ryder was always, over the last years, if not forever, the medical director of the center, but you were in private practice and oversaw the center. But now, our 60% or so of the time? Three-quarters, okay.
That's 75.
Thank you. Okay. And so you passed math in pediatrician school.
No.
Dr. Bill Sorrell is another retired pediatrician who is now three-quarters of the time.
Three-quarters of the time.
So our clinic now is able to provide services for children of San Angelo ISD throughout their school experience in our through the whatever time they're in school. And another thing we did to improve, and then we're going to get down to the nitty-gritty of what y'all really do, is when I got here, the whole clinic was in a portable building. And now not only is that portable building still being used, but it's been a little bit of renovation on the inside, Scott, for you and you folks to provide some mental health services. But then the health clinic is in the metal building there that the school district renovated, gutted really, and renovated nicely into a clinic inside. Probably doubled or more than that. Do you think?
It increases
it's 4 times.
4 times.
Oh my!
Than the
okay.
Old clinic, yeah.
I don't have spatial strengths, and but what I want our audience to get a little grasp of the kind of services this community is offering, and how does a child get to be seen. Our school people you all have met with you met with them a few days ago when they all came back, the principals, and they, I think it might have embarrassed some of you sitting here because they were so gushing with appreciation. You all have saved some kids, have helped us so much and kept them in school. So, but I want our audience to know about what are the things you all are hoping now with a full staff, the best staff, to help our children and help our caregivers to know what you all are offering.
Well, I've been there the longest.
Okay.
What we're trying to do and have done for the last year is to provide services to anybody that's a school age, and it is not limited to SAISD.
Okay.
It's limited to anybody or children who are full-time students in any district.
Okay.
And our policy is that we want to make care available for everyone from their basic health care needs, their basic physical examinations, and emphasize what we've seen grow over the last 15 to 20 years is a marked increase in the need for evaluation of mental health services. And so that's what our goal was, and that's what we've been trying to do.
Do y'all want to add to that?
Well, I do want to add, we do see children under the age of kindergarten. We'll see them, little kids in the families from birth on up and through their school years. My role is to do the general pediatrics, and I focus a lot when I'm doing that on the well checks to screen for mental health problems. And once I screen for them, then have them come back and evaluate it in more detail and see if it's something easy that I can do or something hard that I bounce over to one of these two guys to take care of.
Yeah, and I'd like to add also that really our goal has always been to try to provide more of a holistic type of care to everybody, in the sense that we like to approach the children from a multidisciplinary team type approach, because we all have very different training and have specialized in different things throughout the years. And Dr. Sorrels and I have worked together a little bit longer and have had great success with taking a look at things from different perspectives and getting together and being able to meet. So it's kind of a, if you will, a one-stop shopping. So, because a lot of times the kids will come into a pediatrician's office and something will be identified, but then because of the shortage of mental health providers in town, it will take them a significant amount of time to get referred. They have to wait, things like that, where pretty much on any given day of the week, depending on my schedule or his schedule, it's not that unusual that we could have a child who maybe Jane screens as having something that she wants evaluated further, or Dr. Sorrels sees that needs to be evaluated further, and they can just have them come right over, which is about 20 feet over to the other building. And so that we're able to hopefully do that without letting the child walk away without feeling like they didn't get anything, because a lot of the times there's such a wait to get seen by mental health in particular. I don't provide much testing. I do some testing for us within the clinic, just personality types of testing, and but as far as the educational testing, I leave that up to you guys. And but it is something that we've all been very interested in attending ARD meetings and such, to try to help advocate for the parents and for some of these patients that maybe don't know really what it is. They're very overwhelmed sometimes in these ARD meetings, and we try to go there as much as we can. And I think that's why you had said we were so welcomed by the principals, is because we've really kind of taken it to the streets, so to speak, and make ourselves available to these things. And even though our schedules are very busy, it's very important to us that we see these children living in a very multi-systemic environment. They have the home, they have the school, sometimes they have the juvenile justice system. There's just a tremendous amount of systems involved, and we all need we try to coordinate and approach it so that everybody's on the same page, because a lot of times we get very fragmented treatment plans because nobody knows what the other person's doing. So,
well, you touched briefly on the fact that one of the reasons the principals were so grateful is they all now probably have had an experience with you, Scott, and Bill at one time or another at an ARD. And I think another thing that I'm seeing us do better and better is communication, and speed of communication for a number of students is a critical thing. And sometimes it makes the difference in stopping, diffusing something before it gets so huge. And I particularly have, since about my second or third week here when I met you all, and I appreciate more than I can ever tell you, you all initiated that. And but through these 3.5+ years, multiple times, because of us having access to each other quickly, you know that I'm going to get back with you instantly and vice versa. But we trust each other enough to know that we aren't going to tempt that relationship. It's just been a great relationship. Sure. Because when I see your name on either an email or a phone message, I know that a child's life is depending on me to quickly get back. We're not just chatting the time of day. And I think the thing that gives me such a good feeling is I know from having lived and worked in other cities like all of us have, this is the exception instead of the rule. And not to say that we will always agree, even though I can truthfully say I have every single situation we have worked on, I've been in total agreement on. But the reality is we're a team who I believe have only the child's best interest in trying to help them have the best quality of life they can have. Can you tell us what age child do you see the most of? And it might be different as a pediatrician than from mental health issues.
We'll start with yours, kind of broad spectrum.
Yeah, I see a broad spectrum. I must say, now this is August, and it's back to school, and golly, the number of like 10 to 18-year-olds in sports physicals is overwhelming this month. But typically, I see more of the, probably between ages about 3 and 10 with acute minor illnesses or asthma.
Would you say that is one of the biggest reasons children come to you with illness? Is it? Give us some examples of the major categories. Asthma.
I see some simpler ADHD type patients. There's also high blood pressure that we're seeing and problems with weight. And of course, things like head lice, stuff like that.
And don't you think, and hopefully it has over the last decade and a half since I was a principal, the treatment for that has changed or improved, or do you see any improvement?
Well, for the head lice, we're seeing an evolution in thinking. We've always known that head lice did not cause any disease, but is uncomfortable and not something you want to think about too much. So we've gone from You can't have any little nits or eggs in the hair, so the no knit policy is out.
Good.
And just recently, the American Academy of Pediatrics has suggested in a policy statement that even live head lice should not be a reason to exclude children from school, although we do want to treat them.
Wow, that's a huge.
Huge difference.
Huge difference.
And it's basically, I think that that's because so many children at a critical point in their education, the KG up to about the 4th grade, there's just many of those children that miss too many days of school because they've got a nit or somebody thought a louse move. The point is that this is a disease that is not that communicable. It doesn't cause any quote-unquote disease states, does not carry any diseases, and is not a vector to carry other diseases. You get it because you're intimately close to another person or you share their headwear. And since if we don't share headwear and we're not sharing pillows and we're not living in the same household, the probability of getting head loss from another member of a classroom is relatively unusual.
Well, I'm delighted to know that because that thinking, this is appropriate and helpful thinking for us keeping kids in school. So you two guys then, is it appropriate for me to ask what are the main reasons you see children and young
Sure.
teenagers and
I mean, I get a lot of referrals outside of Dr. Sorrels and Dr. Ryder. I work very closely with Dr. Herbert. Dr. Wayner sends me a significant amount. So do mainly any of the pediatric groups in town. Dr. Acton sends me some from community. So I get a lot of outside referrals. I also get a lot of phone consultations from family practitioners, nurse practitioners in general. There's such a shortage again of mental health professionals that the first point of contact is primary care, and so a lot of the doctors feel comfortable with some of the basic stuff, but sometimes they'll call and they'll bounce something off of me and then ask me to follow up. Those cases aren't really cases that I follow for any length of time. That's more just kind of a quick consult and move on. There's a big misconception, I think, that just because somebody walks through my door that they need, 5 years of psychoanalysis or something, and it just doesn't always apply that way.
thank goodness.
Yeah. No, thank goodness is right, because I would burn out very quickly on that. Again, I see, unfortunately, and this has been the case for a number of years, and it's not just Texas, this is pretty much a trend across the country, is that I see a lot of children, really I'm going to say I still see the whole 3 to 18 pretty much. Prior to age 3, I usually, if someone comes in, I usually will work with the parents more than the child. But we see things ranging from I don't see from autism, but there's just not a lot of autistic kids. I mean, there's a lot of, it's very difficult right now with the hot diagnosis of the day is this pediatric bipolar, and the jury's still out on that, and so but really I think that the majority of my cases are kids that really are in foster care or that are being raised by their grandparents because their parents have been incarcerated due usually to the primarily one is distribution, manufacturing, or use of methamphetamine seems to really, that's just not, again, that's not here in San Angelo, that's nationwide. And so I have a lot of grandparents that are bringing their kids in. I have people being brought in by JJC. So I mean, I see some pretty complicated cases in the sense that again that we're not just dealing with a nuclear family. We're dealing with Department of Social Services. We're dealing with the Department of Justice, things like that. And so there's just a tremendous amount of just labor-intensive work that goes into that. But I would say that the primary diagnoses that I see are depression and anxiety. Anxiety, I think, is probably misdiagnosed and underdiagnosed more than any other disorder that is in the DSM-4, in my opinion. But a lot of post-traumatic stress disorder, some of the more severe mental disorders really don't present until young adulthood. There's the thinking on that's changing a little bit, but again, the research really isn't completely in yet, and we see unfortunately a lot of children that are born that have been exposed in utero to some sort of teratogen, i.e. alcohol, methamphetamine, cocaine, and their disorders mimic things that look like something that might be bipolar, or they mimic something that looks like attention deficit hyperactivity disorder. But really what it is just kind of more of a organic type of syndrome that the child is born with. And the terminology these days is that it's a neuroatypical child. The children that I can honestly say over the years are getting more and more complicated because they don't respond to traditional treatment, they don't respond to traditional psychopharmacology, and it's just very complicated, and trial and error. We're soft science, so to speak, in so many ways, and people don't like that. They want to draw somebody's blood and see what's wrong and get the fix, and it just doesn't work that way.
Well, the trial and error you just referred to is one of the reasons our school and you all communication and quick response is so critical, because as you just said, I see more and I'm glad there's trial and error, and that we're not having to go long periods of time before we make adjustments. People ask me, not only school people, but people in the community ask me, are we really having more mental health, kids with mental health issues, or are we just now diagnosing more? I know you get asked that. What's your answer today?
What I think that we're seeing is a lot of neurological disorders that mimic these things, and I just really feel that I can tell you that I've done more undiagnosing than diagnosing since I've been in San Angelo, because kids have just been misdiagnosed. And not necessarily by people here in town, but just because, we see people from all over the areas, because, we're Medicaid providers and not a lot of people are seeing these kids. But I think the cases are more complicated than I used to see. But the prevalent incidence to me doesn't seem to be that much greater.
Well, I'm encouraged by that, quite honestly, because I have not known a good answer to that question. I think the media, particularly on numbers about autism, that's a fear factor, the way the media portrays that those numbers have exponentially increased. And so that's a hopeful comment you made.
And I would have to agree and maybe slightly disagree. I personally think that there may be a broader spectrum of children that end up being classified as behavioral disorders or mental health disorders than there were 30, 20 years ago. But I don't think it's because there's a real increase in the disease. I honestly believe that, as Dr. Storm alluded to earlier, there is a breakdown in the ability of the family, parents, mom and dad, to establish appropriate time with their children in those years when they need it. Because you can't make a living and take care of a family on $8 or $9 an hour or $10 an hour. And so if you're going to have any kind of a semblance of a lifestyle, you're going to have at least two people full-time employed. And I believe this from my heart of hearts, that one of the things that's happened is that our children have somewhat been sacrificed at the mandatory working for food stamps and Medicaid benefits for parents. You know, that's something that changed about 20 years ago. And it's something I'm not sure was a good change, because I personally would rather see a mother being able to raise 2 children 40 hours a week at home than have to work 20 hours a week and not be able to emphasize learning social skills. How do you interact with other people? What's acceptable? What's appropriate? Because in a lot of ways, I think what's happened is, Carol, is that the system has shifted that responsibility to our school system, which I don't agree with, but it's a fact.
Absolutely, it's a fact.
It's a fact. And so...
And I am not one who spends any amount of time blaming, but I accept that fact, and we do what we can to help bridge the gap.
Yeah.
Is it a fair statement at all to say that we as a society are further along in research on physical health issues than we are with mental health issues?
I think that's true.
I do too.
Yeah,
And-
'cause-
and
and
I-
like Scott said earlier, I'm sorry, but it's soft science, you know, and we don't like soft stuff. We want to be able to say, this is how you get to the moon, this is how you get back.
Yeah, and I think we still have a lot greater acceptance of physical disease than we do mental disease. We haven't quite made the transition to the concept that the brain is part of the body. And so mental illness is just as real as physical illness.
Well,
Statistically, it's higher.
Yeah.
If we
There's
believe, and statistically, as I understand it, anywhere between 9 and 13% of human beings have some diagnosable mental disorder.
Well,
That's
but-
a lot of people.
Well, relevant to this conversation, 10% of our teenagers have depression.
10%, yeah.
Yeah. Well, I just wanted to add too that yeah, and it is pretty high.
9% have ADHD.
You know, the more sophisticated it seems that we get with some of the more hard science aspects of basically in imaging the brain, what we're finding out is that the brain, the more we find out about the brain, we realize we know nothing. And that I was at a conference back in at Harvard not too long ago, and one of the leading experts in movement disorders said that he has dreams that he could go back with some whiteout and through all his articles that have been published, because everything he wrote was wrong. Just because we're finding out that it's a much more complicated system, that there's much more what they call neuroplasticity or neuroelasticity that's going on in the brain, which is very actually optimistic, because where we once thought that the brain couldn't compensate for certain things, we're now finding that that's not true. And so now I'm not saying, you know, we're growing new brain cells. That's science fiction at this point. But there certainly is there's just overwhelming evidence that these cognitive neural networks that are formed tend to almost create a form of artificial intelligence where they're now compensating for other parts of the brain that we just thought was if a localized specific area was injured, then that was it was done. But now we're seeing that there's other parts of the brain that kind of, you know, come to integrate with it and assist, and functioning is coming back that we never have seen before.
Let's end this for this first segment by thanking our strong partnership with Angelo State University, Department of Nursing, and the Health Foundation, who has given us a lot of money to do things, and the partnership that our staff feels with you, our principals and teachers, and we just want it to get better and better. Thank you so much.
Thank you.
Thank you. Thanks for the opportunity to share our thoughts.